G'day, Dr. Matt Robinson here with you from ReadyVet, and today we're discussing performing a distance exam, which is something I would typically do as I come through the door when I'm about to consult with a client and their patient. I'm already thinking about how is the animal. It's much more difficult if we've got a cat in a box and wouldn't typically start until we get into the consult room, but with dogs, I'm already gaining some information. This dog sitting here, this is our dog, this is Dog the dog. He's, as you can see, he's engaging with me, and that's the important thing. I'm already logging that in my brain. Sick dogs won't engage so much, they're just disinterested in what's going on around them. So other things that we can glean from a distance exam might be swellings, evidence of lameness, some signs of skin disease, a scratching dog, a coughing dog. Occasionally they're vomiting, sometimes they've got diarrhea, they might be bleeding. All of these things are things that you can pick up from a distance exam. So I might just get him to stand up and I can see, okay, he can stand up, which is something that's telling me, right, well, we're already ruling things out, you know. Snake-bitten dogs can't stand up, tick-paralysed dogs can't stand up. Can he walk around? I want to see him walk around. Also, he can hear. I just threw that, he can see where it's gone, so I can tell that he can hear, even though he's 12 years old and his hearing is going. He's actually, look at that, he could focus on that, and he can also eat and chew and swallow. So all of these functions are happening normally. He's got some appetite, this is good stuff. He hasn't got any evidence of lameness. Just getting to move around a bit more. These are all things that I'm logging. Now, when we then move into the consulting room, I'm going to perform a nose to tail physical exam essentially, and I'll get much more information. But from my distance exam, I'm quite happy that, you know, there's probably not something major going wrong here. We might find some other issues once we start looking more closely, but come here, dog. Sit. Good boy. Things are looking pretty good. Cheers. Alright, so now we've moved into our consult room and we've popped the dog up on the examination table. Any dog under about 25 kilos I'd put up on the table. Any dog bigger than 25, maybe on the floor, is a good idea. Put them on the table. It helps, it makes things much more easy because we're looking directly into the face. So I start nose to tail essentially. This is my standard physical exam, and lots of vets will perform an exam like this while taking a history with the owner and not even necessarily being totally obvious that we're examining the dog. So first of all, I look up at the gums. So it's basically I open the mouth and I'm examining all the teeth. Cracked teeth, dental disease, he's got missing teeth. This is all these are common things that we see. Also, I'm looking at the mucous membranes. What colour are they? They're nice and pink. I touch them, they come back to pink straight away. So I'm thinking about the capillary refill time. I'm looking at the nose. Is there any discharge there? How are they breathing as well? Can I hear any issues with the breathing? This is all the close-up stuff. Next, I'd move to the eyes and actually open them up with my fingers. I want to have a really good look at the eyes. Sometimes it's difficult in dogs with lots of hair around the eyes, but in him it's obviously quite easy. Often you can see jaundice in the sclera, the white part of the eye. I'm looking at that. I'm also pushing the eye back into the head so that the third eyelid comes across. I want to have a look at that. We see some tumours and things in the third eyelid from time to time, or other conditions with that. Ears. Next we go to the ears. Ear infections I see nearly every day. Pass the smell test. We want to smell the ears. Can we smell anything in there? But dogs, bit of a design fault, have an upward facing funnel for an ear, so we do see lots of issues. Then I typically move to the stethoscope as I'm moving back, but we'll get to vital signs in our next video. So basically I'm just running my hands over the dog, feeling for any issues, any swellings. I can also, you know, get a bit of an idea about the musculoskeletal system. If I've already identified on our distance exam that we've got a limp or something, then I've logged that, and that's something that I want to view more closely. But on a standard physical exam, I probably wouldn't perform a complete musculoskeletal exam, for example, unless the dog's lame, or if they're old and I'm concerned about arthritis, I might start doing some flexion of joints, that sort of thing. But I'm moving over the dog like this, then I'm moving to the abdomen. Well, he doesn't like that, so we'll stop. That's always a good idea. Don't push the body, dog. But that's abdominal palpation. Maybe he's got a pain, maybe he's got a sore belly. These are things that I'm thinking about. And then have a look at the bum, even if I'm not taking a temperature, if it's a body animal. then I still want to have a look at the bum, look at the genitalia, the gonads, that sort of thing. Again, I probably wouldn't go to too much effort concerning the musculoskeletal system unless I already had an inkling that there was something wrong. Perhaps the history might have pointed to that. So that's our physical exam. It's mostly concentrated on the head, but certainly will include assessment of the vital signs, your capillary refill time, your mucous membrane colour and character, are they dry? Also taking the pulse, listening to the heart rate, but we'll get to that next video. All right.